One of the questions, Dan, is they're having a problem, one of the practices, with patients don't qualify for financing. So what do they do?
Okay, so obviously time spent with somebody who's not qualified can be time wasted. That said, you are in medical, you're not in retail, right? So this isn't somebody coming to buy a TV. This isn't somebody coming to get their next cell phone they probably could live without. This is medical. So I want you to get your hard sell in. And what is hard sell? Okay, MGE, ABC communication and sales seminars. You remember, hard sell isn't crush sell. It's not threats, it's not scare tactics, it's not doing anything weird. It's caring enough about the individual. Help them overcome the stops and barriers preventing them from getting the treatment they need to be fully healthy and rehabilitated. That's what hard sell is. It starts with the word caring. So first factor, if you're running into stops and somebody appears unqualified, first thing I want you to do, make sure your care factor is high. We don't really care about financial at this point. All we're looking for is willingness. What is the person's willingness? Are they willing to be told what they need? Are they willing to be told that this is the treatment that is going to fix the problem that they have? Are they willing to accept this solution you're presenting? And are they willing to agree that, say they had the money, they would take that money and spend that money? So question I want you to ask your patients is as follows. Mr. Jones, Mrs. Jones, whomever, I understand about the financial concerns, and it looks like we went to try to get you approved and that didn't go through. Let me ask you right now, if the money appeared magically right next to you, right here, and it had your name on it, it was earmarked for you, and you could use it for whatever you want, would you take that money and go forward with the treatment, or would you use it for something else? If they say, well, actually, I really have this repair in my roof I need to do, or actually, I need to do this, that, or the other thing. Well, then you know that that person is not technically closed on their treatment plan. They haven't actually accepted that this is something they need. There are other priorities above it, which means you need to represent. You need to go through the treatment plan, let them know of the potential consequences, etc. So make sure that point is handled first. The second point is once you've really done that and you really get them up to the point of wanting and desiring that treatment, whatever it takes, watch what they do. They might not be able to do this right here, right now. They might need to go talk to their aunt, their uncle, their father, mother, grandfather, child, whatever. And they will say, listen, I'm in a spot here and this is what's going on. Just like if their transmission stopped working in their car and they need their car, they got to do something. What would they do in that emergency situation? So you can pose that question. Mr. Jones, as you can see here, we're at a bit of an impasse. We got to get on the other side of this. Let me ask you this. In the case that, say, your transmission went out and you need your car to go to work, to go pick up your kids, etc. How would you handle that emergency situation financially? What would you do? Mr. Jones will look at that deep and thick and go, I mean, I hate doing this, but I'd probably have to call my brother. I mean, he's so arrogant when I come to him asking for money, but he got so much money and it gives me a little bit of heat. It's just insulting and it feels horrible. I understand. Do you think your brother would help you if you explain the circumstances? Of course he'd help me, I just don't want to. You're gonna find there's something they don't wanna have to do, but if it was an emergency situation, they would do it. Make sure you have that conversation. Now, say the person says, I don't have anything, I don't know what to do. Get them, of course, you do what you need to do clinically, doctor, right? You have a clinical responsibility to do what you need to do. I'm not clinical and I'm not gonna give you advice in that direction, but you're gonna do what you can to make sure that they're not a clinical emergency. Then you're gonna give them direction and let them know that you're here and you're gonna follow up with them. If they're unqualified, it might take them a month, 2 months, 6 months. We've all seen it. The person comes back into the practice. You've impinged on them. They are now in a better spot. And they say, thank you for being patient. I've got the money together. I hope things aren't worse. Can we take a look at it? I'm ready to go forward with the treatment. And that's what I would do.